If you've been struggling with neck pain, shoulder tightness, or even that stubborn ache under your shoulder blade, and nothing has worked, not the surgeries, not the painkillers, not the massage therapy, not even physical therapy, then this video is for you. Welcome to Doctor for Awareness with DR.KADE. Today, I'm going to show you the surprising hidden cause of neck and shoulder pain that almost no one talks about. I'll show you a quick 30-second way to test if this is what's behind your pain. I'll also explain exactly what you can do to get rid of it naturally, and I'll even cover what it means if this turns out not to be your root cause. And here's the important part. By the end of this video, you'll not only know how to test yourself, you'll also learn what steps you can take to finally reduce the pain if this hidden issue is the cause. And if it's not the cause? I'll also tell you where else to look so you don't waste time and energy going in circles. So stay with me, because this could finally give you the answers you've been searching for. So if your pain isn't coming from your spine or your muscles, then where is it really coming from? Most people are shocked to discover that one of the biggest culprits of ongoing neck and shoulder pain isn't the neck at all. It's actually connected to your liver and gallbladder. Now that may sound strange at first, because we're used to thinking of pain as coming from the exact spot where it hurts. But the human body doesn't always work like that. It has something called referred pain, where one area in the body is stressed or irritated, but the brain perceives the discomfort in a completely different area. And that's exactly what can happen with your liver and gallbladder. Your gallbladder is a small sac that sits just under your rib cage. Its job is to store and release bile, a fluid made in the liver that helps you digest fats. When bile flows freely, everything works as it should. Your liver makes bile, the gallbladder stores it, and when you eat a fatty meal, the gallbladder squeezes and releases bile into your small intestine so you can break down and absorb fats. But if bile becomes too thick, or turns into what doctors call bile sludge, pressure starts to build up inside those delicate ducts. And here's where it gets interesting. That pressure irritates a key pathway called the phrenic nerve. And this nerve doesn't just affect your diaphragm and breathing, it also sends pain signals right up into your neck and shoulder. So the pain you feel up here in your neck, or in the top of your shoulder, may actually be starting down here in your gallbladder region. Why conventional treatments fail. This also explains why so many people never find relief. You go to a chiropractor, you get massages, you may even try surgery or medication. But all of those treatments are only chasing the symptom, the tightness, the spasms, the inflammation. They are not addressing the hidden congestion in the liver and gallbladder that's triggering the nerve in the first place. I've seen this with countless people. It becomes a cycle. They get temporary relief from treatments, but the pain keeps coming back. And the reason is simple: the underlying issue is ignored. Most people assume that gallbladder-related pain only starts once gallstones are formed. But that's not true. There's actually a stage before gallstones, and this is where pain often begins. When bile becomes too thick and sluggish, it clogs the ducts before stones are even formed. That sludge creates pressure, and that pressure sends referred pain into the right side of the neck, the shoulder, and sometimes even down the arm. So if you've ever wondered why your pain keeps coming back despite treatments, this may be the missing piece you've been overlooking. How to test if this is your cause. Now, let's talk about how you can find out if this is what's causing your pain. Here's a simple way to test it at home. Place your hands gently under the right side of your rib cage. Press upward and slightly inward. Slowly move around until you find a tender or knotty spot. Once you do, hold pressure there. If within seconds you start to feel relief in your neck or shoulder, that's a very strong clue that your pain isn't really coming from your neck at all, it's referred pain linked to liver or gallbladder congestion. And here's the exciting part. If that quick test gives you relief, it means your pain may actually be fixable without endless therapies. What causes bile to thicken? So what makes bile thicken and cause all this trouble in the first place? There are several possible factors. First, lifestyle factors play a huge role. Heavy alcohol intake, processed foods, refined carbs and sugar, eating too many unhealthy fats. Second, certain medications can strain the liver and gallbladder. For example, statins, antibiotics, and antidepressants are known to affect bile quality. Third, hormonal imbalances, especially high estrogen levels from birth control or hormone replacement therapy, can make bile thicker and sluggish. Over time, these stresses change the delicate ratio of bile salts to cholesterol, and when bile salts drop too low, cholesterol thickens the bile. The result? Sluggish flow, pressure buildup, nerve irritation, and neck pain. How to fix it? The first step is to remove what's causing the problem. Cut back on sugar, processed carbs, alcohol, and unhealthy fats. Give your liver and gallbladder a break from constant overload.
The next step is to support your bile flow naturally.
One powerful aid is a compound called taurine, which helps your body produce bile salts. Another option is TUDCA, a special form of bile salts that can thin out sludge, support the liver, and reduce pressure in the ducts. When that pressure eases, the nerve irritation often does too, which means relief in your neck and shoulder without endless doctor visits or invasive procedures.
But what if it's not this?
But what if you try the test and don't feel any change at all? Then your neck pain may be coming from a more direct muscular or structural issue, things like posture, spine alignment, or chronic muscle strain, which I commonly see in clinical practice. If you'd like me to make another video explaining those causes in detail and what you can do about them, let me know in the comments below. The key is this: if the simple test gives you relief, you've likely uncovered the hidden cause. If it doesn't, at least you know to look in a different direction instead of wasting years on treatments that won't work. And if this video helped you, make sure to subscribe to the channel so you don't miss the next one. The purpose of this channel is simple: to make people aware of the hidden connections behind their health struggles so they can finally get real answers to what's going wrong. This is DR.KADE, and I'll see you in the next video.